Hi, I'm Dr. Rachel Pope, board-certified OBGYN and co-founder of Menopause. Welcome to Office Hours. This is a podcast where we talk about menopause, perimenopause, and other things that you should be talking to your doctor or healthcare professional about, but probably aren't. Come on in. No appointment needed. I am thrilled to have Dr. Danette Conklin. She's a psychologist specializing in midlife women's health. She's an expert in cognitive behavioral therapy, and she's going to tell us what that is in a moment. And she researches women's health and healthcare disparities. Just to mention, she does work for an amazing employer, but her opinions do not necessarily reflect those of her employer, just as a disclaimer. And we're so excited to have you here, Dr. Conklin. Thank you for your time.
Thank you. It's a pleasure to be here, and thank you for inviting me, Dr. Pope.
So let's dive right in. What would you like all women to know about mental health and perimenopause and menopause? What is something that you see in the office regularly and you just wish that everyone out there knew?
Well, what I wish that every woman knew is that if they are noticing changes in their body, if they're noticing that they have a low tolerance for frustration compared to how they usually would handle frustration or certain situations, or if there's seemingly, seem that they're getting more depressed or more anxious and feel like they're losing their mind, you're not losing your mind.
Yeah. And do you see depression as much as you see anxiety? Is it a mix of both, or do you see them together? How do you tease those two things apart?
Oh, it's definitely a mix. I tease them apart just by diagnostic criteria. And I would say that many women will tell me that they can't turn their mind off. That is actually more common than, I would say, depression, in my experience anyway. The depression would be more like not being motivated to do things, having a hard time getting moving. But a lot of times, women, when they're experiencing depression during perimenopause or postmenopause, it is highly likely that they have a history of major depression or some type of anxiety disorder.
And if people have a history of depression or mood changes or anxiety, do you expect it to get worse during menopause, or, what should people be on the lookout for? Like maybe they're already on medications. Are they going to need more, or what are the things that you've seen?
Well, what I have seen, and this actually has come through research as well that we've conducted, is that the depression just feels more severe. The anxiety is more intense. So, and especially for women who have a history of sensitivity to hormone fluctuation, hormone changes, it is like, at least I would say this is kind of being a bit modest, but 2 times likely to have more severe depression if they have a history of major depression. And there's not as much research out there about anxiety.
Yeah, I always wonder that. Like, why is there not as much out there about anxiety? Even we see this in postpartum depression. We see anxiety is also very common, but nobody really talks about postpartum anxiety, just talk about depression.
It is common, even just like you said, even with postpartum anxiety, it's not talked about as much. It's almost like it's downplayed compared to depression. And actually, anxiety can be just as debilitating because it can cause women to avoid things and go places to isolate. It could cause, women to just not perform as well because they're just so nervous and anxious and catastrophizing so many things. And I think it's good practice to assess for anxiety, in perimenopause, postmenopause, and certainly in postpartum as well.
Yeah. What would tip somebody off to say, okay, this is not just being a worried wart, or this is not just your typical kind of worrisomeness? What would tip someone off that this is actually anxiety? This is something that could benefit from treatment?
Oh, gosh, that's a good question. So the things that come to mind would be just kind of like a change in how you're seeing the world, how a woman is seeing the world, such as being afraid that something bad is going to happen, and that's not typically their MO, or just being more anxious about different things and having a hard time stopping the worry, afraid something bad's going to happen. And also, a lot of times the anxiety can be so intense that it affects their relationships with others. They're always afraid and want to basically warn people not to do things,
And you mentioned mentioned earlier of people not being able to turn their minds off. Is that the anxiety or what is that? Can you explain that a little bit more?
Yeah, I can. It's called ruminative anxiety, but it's a little complicated because let's say if a woman has a diagnostic history of bipolar disorder, it could have something to do with their mind just racing, and that could also be a bipolar disorder
Yeah.
symptom.
Okay.
So then you just have to kind of, do a differential diagnostic interview to see are they meeting criteria for bipolar disorder or anxiety disorder, or is it a combination that's just
Okay.
intensifying when their hormones are changing?
And you specialize in something called cognitive behavioral therapy. Can you tell our listeners what that is or CBT?
Yes, I can. Well, it's definitely non pharmacological and it's the least invasive. And it really is kind of like just examining our thoughts, our emotions, and our actions. And all three of those tend to interact with one another. And it could be something positive as an outcome, or I never want to overshadow the positive, and I always want to reinforce the positive, but sometimes, it's not that.
Yeah. And if someone comes to you, I guess I do have quite a few patients who say that they've noticed changes in their mental health, specifically anxiety, but they don't want to start a medication. They don't want to worry about side effects from that medication. And then also for depression, it's just so hard for women going through midlife because they notice the weight changes of midlife and they don't want to start an antidepressant that's going to make them gain weight. So I do have a lot of patients who ask for something that's not an antidepressant. So I do tend to refer to psychologists like yourself and others that we have here in Cleveland. And that cognitive behavioral therapy, how long does that take? Like if I'm going to send someone or refer someone, what should I be telling them to expect?
Oh, wow, that's a real good question. And, I hate not to give a definite answer, but it does depend. It depends on how severe it is. It depends on if it's recurrent or not. But we could make a lot of progress, I say, in 6 sessions. There could be,
Okay.
a lot of progress be made. I would say, as a general rule of thumb, you could say 6 to 12 sessions.
Okay. And you're teaching them skills that then they can use to cope beyond that point. I would assume it starts to kind of become part of their thinking. You're rewiring the way that they're thinking about the negative thoughts or the anxiety thoughts.
Yeah, I mean, that's right on, Dr. Pope. So let's say, for instance, to me, this is a, classic example, the word menopause. We have done a lot of menopause groups. When we ask, well, when we say the word menopause, what comes to mind?
Yeah.
Old, not needed anymore.
Uh,
That's all negative.
a
And
lot of
so we want to
negative.
help
Yeah.
women to reframe that.
And so that's
Mhm.
even part of cognitive behavioral therapy is reframing the idea of menopause.
Yeah,
Oh, nice.
absolutely.
And I would ask you if you had 3 tips that you wanted to tell women, to protect their mental health as they're going through this life stage, what would you tell them to do?
First of all, it's hard to narrow it down to 3 because there's so many things they can do.
I'm sure.
But
I'm
I
sure.
would say, generally, and if I kind of like think of like all the women that I've seen, I would say take inventory and see what's going on in your life that's increasing the anxiety or depression or making you feel overwhelmed. And then look at that list and see which is contributing more or less. And then I would say, let's start marking them off the list. Let's start problem solving, from there. So those would be, I would say, maybe the top 3. One that any woman can carry with them day and night, wherever they are, is deep breathing.
Okay.
And deep breathing does so many things. Decreases stress, which increases hot flashes. So if you decrease your stress and do deep breathing, that's going to help with hot flashes. It
Yeah.
also helps reduce anxiety and manage depression. So I would say definitely do deep breathing. And, the other thing that I would certainly say is, for women to educate themselves, to get information from their providers or certain websites or books, because that way you'll know that, oh gosh, this is normal. Oh, I'm not the only one going through this. So kind of normalize it a bit.
Okay, that makes sense. No, I love that. I wanted to ask you a little bit about your research and health disparities too. I feel like that's an area that's near and dear to my heart. And here in Cleveland, we have a lot of health disparities, unfortunately, whether you're looking through maternal health or infant mortality. I mean, you name it, unfortunately, we've got health disparities here. And it's a good place to be doing research and advocacy. And I would love to hear how that's translated into your work in midlife women's health. health and menopause?
Well, what I've been doing so far is research in health disparities in hormone therapy prescribing, so doing this research, yes. And we have found a lot of disparities in this research. There's definitely a racial disparity and differences, in terms of like insurance type, education. So a lot of your standard ones, social determinants of health,
Yeah.
we're seeing where they're just not getting as much education comparatively to other races or income levels or education levels.
Yeah. And so I've talked to some women in the area about this, and we talked a lot about kind of a mistrust with the healthcare system and how, when you have heard all of the craziness that came out from the Women's Health Initiative that scared everybody off of hormones, and you already mistrust the healthcare system, it's like you have a whole nother layer that you have to break through if you want to make individualized decision about hormones. I don't know if you agree with that or disagree, but we just talked a lot about, historical mistrust and how that ends up really just making it hard to have relationships with healthcare professionals, and how you have to kind of create this extra sort of, this extra layer of trust forming, relationship building in order to kind of break through all of this horrible history that exists.
Yeah, no, I agree. And the good thing for me is that as a psychologist, I tend to have more time with people. Just like any relationship, we have to build trust and they have to feel safe with us. And some women feel that things are being forced on them. So I will say that, a good listening to me is the top priority, that they feel heard. They know, like, if they do not want hormone therapy, just say, okay, we have other options, and let them try other options because maybe they'll work. And if they don't work, then see if they want to try something else until, they hit the jackpot.
Yeah.
And then they'll be like, wow, I hung in there and now I'm feeling so much better and I'm going to tell all my friends.
Yeah. No,
So,
that's interesting. Yeah. And it's another conversation that's kind of come up is that for women of color, they do have a higher risk of breast cancer. And so I've had a lot of my patients of color who have told me, I'm not interested in estrogen. My mother had breast cancer. She passed from it. I don't want that. And just maybe the appointment prior to that, I was just explaining the Women's Health Initiative to someone and saying, you don't have to be scared about estrogen. And now I'm having to kind of reframe and say, I get why you're scared of estrogen. It's complicated. And you're right. Maybe it is just about having time to be able to listen and talk to everyone and meet them where they are.
Exactly. Yeah, that's all I'm saying. Yep. And then they know that she respects me or he respects me. And that's a big first step right there.
I mean, right, we should be getting at least that from our healthcare professionals, but it's unfortunately sad that oftentimes people walk away not feeling that sort of respect.
Right, exactly. So, I mean, to me, that's an easy fix.
Right.
If we just kind of sat down as providers and healthcare practitioners and let's go back to the basics.
Yeah.
Listen, I mean, you go home from work and if you have a partner, do you want them to listen to you? Do you feel better when they listen to you? Well, it's the same thing with the patient. It's no different.
Exactly. Yeah. For some reason, unfortunately, I feel like that skill is not that easy to teach. I don't know. Or somehow it's not emphasized in training programs. I'm not sure what that is. And yeah, we should be looking right from the beginning in medical school, and those who are going to pre-med, we look at chemistry grades and test scores, and we don't look at really training people and evaluating them on their listening skills and how they can build rapport with people.
Mm-hmm. Yeah, to me, that's just kind of like the foundation right there in terms of them patients not only trusting you, but also even coming to you when they do have problems and say maybe they want an extra appointment, or certainly in terms of coming back for more appointments, because it's like, not only do I trust you, but you're also helping me. So you have me for life now. I'm going to keep coming back whenever I have something going on, because if Dr. XYZ can help me, he or she will. If not, I trust that they will say, I'm sorry, I can't help you with that, but I'll find someone who can.
Oh, that's so good. Well, I really appreciated your time and your insight into this area. I think it's so important, and mental health is stigmatized, I think, unfortunately, still this day and age in the US. And I feel like we need to pay more attention to it. We need to normalize it and speak about it more so that when people are going through struggles, they can get help faster and they don't have to live through it alone, especially.
Mhm.
Any last words or anything else you would like to share before we close up?
Yeah, I do. And so thank you for asking that. When you were asking me about the mental health during postmenopause,
Yeah.
and my apologies for this, but
Oh,
with
it's
all
okay.
the physical changes that are happening with
Yeah,
women, whether it is memory problems or forgetfulness,
sure.
vaginal changes, mood changes,
Yeah.
weight changes, there's so many changes, empty nesting, all these life
True.
transitions, all of those, and especially if they're compounded, will affect a
Yeah.
woman's mood. And these are issues that are relevant to a woman's life during this time period.
That's so true. And I think we forget about those significant life changes that tend to happen around this time as well. I don't know if you see this with your patients who are going through menopause, but I have a lot of my patients who their daughters are going through puberty at the same time that they're going through menopause. And it's like they're trying to deal with their children's changes and, the stresses that lie therein and then their own health. And then not to mention even, cancers start to increase around that age. So people might go through some different scares. And yeah, there's a lot. They might be taking care of their own parents and really living through that double burden. Yeah.
Yeah, exactly. And then now, we're hearing more and more that adult children are moving back home. Probably temporary, but, still
Yeah.
doing it. But like you said, the sandwich generation and potentially more medical problems and all types of life transitions happen during that time
So
period.
they need a therapist. They need to see a psychologist like you.
We're helpful.
Yes, you are. We can all benefit. We all benefit. So, no, it's wonderful work that you do. And I really appreciate your time tonight. And I appreciate all that you continue to do. And I can't wait to see what you do next with your research.
Thank you. I appreciate it. Thank you again for inviting me today, Dr. Pope.
Thank you. My pleasure.